Hello and welcome to Senior Health, the channel dedicated to empowering you with real, relevant, and science-backed information to help you live your best life after 50. Today, we're diving into an issue that millions of men face, but far too few talk about: prostate enlargement. It's one of those things that can quietly creep up on you, with subtle symptoms that are easy to dismiss until they're not. If you're a man over 50 or you love someone who is, this is a topic you simply can't afford to ignore. Prostate problems don't just affect quality of life, they can signal more serious health concerns that deserve your full attention. In this episode, we'll walk you through everything you need to know about prostate enlargement: what it is, why it happens, and the symptoms that should never be brushed aside. Let's get started. The prostate is a small, walnut-shaped gland located just below the bladder and in front of the rectum. It plays a vital role in the male reproductive system by producing seminal fluid, the liquid that carries sperm during ejaculation. For most of a man's life, the prostate remains about the size of a walnut. But around the age of 40, something begins to change. Under the influence of hormonal shifts, particularly the balance between testosterone and dihydrotestosterone, DHT, the prostate starts to grow. This gradual enlargement is a natural part of aging for many men, but it doesn't come without consequences. By the time men reach 60, over half will experience some degree of prostate enlargement. And by age 80, that number climbs to nearly 90%, according to the National Institute on Aging. While some men may have no noticeable symptoms, others may find that this subtle change leads to frustrating and even alarming disruptions in their daily lives. Understanding the basic anatomy and function of the prostate helps set the stage for recognizing when something isn't quite right. And when it comes to your health after 50, knowledge truly is power. The medical term for prostate enlargement is benign prostatic hyperplasia, or BPH. The word benign means it's not cancerous, and hyperplasia refers to an increase in the number of cells, which causes the gland to grow larger. While BPH isn't prostate cancer and doesn't increase your risk of getting it, it can significantly affect your quality of life if left unchecked. So what exactly causes BPH? The exact mechanism isn't fully understood, but research points to age-related hormonal changes, particularly a drop in active testosterone, as one of the main culprits. As testosterone levels decline and estrogen becomes more dominant in the male body, the prostate responds by growing, sometimes slowly and steadily, sometimes more aggressively. According to the Mayo Clinic, BPH is one of the most common conditions affecting older men. In fact, it's so prevalent that some neurologists consider it a normal part of aging, but that doesn't mean it should be ignored. Even though it's not life-threatening, BPH can lead to complications like urinary tract infections, bladder stones, and kidney problems if symptoms are left untreated. That's why understanding the condition is the first step in managing it well. One of the most challenging aspects of BPH is that its early symptoms can be deceptively mild, easy to overlook or brush off as just part of getting older. But recognizing these subtle signs early can make all the difference in maintaining both comfort and long-term health. The most common early symptom is frequent urination, especially at night, a condition known as nocturia. If you find yourself waking up 2, 3, or even 4 times each night to urinate, your prostate may be pressing against the urethra, making it harder for your bladder to fully empty. Another telltale sign is a weak or interrupted urine stream. You may also notice hesitation at the start of urination or a lingering sense that your bladder isn't completely empty afterward. Other early warning signs include urgency, a sudden strong need to urinate, straining, having to push or bear down to start urinating, post-void dribbling, the feeling that you're done only to leak a little more afterward. These symptoms might feel like minor inconveniences at first, but they're often the body's way of signaling a deeper issue. According to the American Urological Association, any of these signs, especially when they appear in combination, should prompt a conversation with your healthcare provider. Early detection not only improves treatment outcomes, it can prevent far more serious complications down the line. As prostate enlargement progresses, the symptoms tend to become more persistent and more disruptive. What may have started as a slight inconvenience can evolve into a daily struggle that affects sleep, productivity, and even emotional well-being. One of the more concerning developments is incomplete bladder emptying, which increases the risk of urinary tract infections, or UTIs. When urine sits in the bladder for too long, it creates a breeding ground for bacteria. Over time, this can lead to recurrent infections, which may cause burning during urination, fever, and pelvic discomfort. Another advanced symptom is bladder stones, which can form from residual urine and cause pain, blood in the urine, or further blockage. Even more serious is the possibility of urinary retention, a sudden inability to urinate at all. This is a medical emergency that may require catheterization or even surgery. In rare but severe cases, long-term pressure from the enlarged prostate can lead to kidney damage as the bladder works overtime to push urine through a narrowed urethra, ultimately putting stress on the kidneys. Dr. Kevin McVeary, a renowned urologist at Loyola University Medical Center, emphasizes that, quote, once the bladder starts losing function due to chronic obstruction, it's difficult, sometimes impossible to reverse. That's why timely intervention is crucial. The longer symptoms go unaddressed, the higher the risk of permanent complications that can severely affect a man's independence and lifestyle. Despite these risks, many men delay seeking help for prostate symptoms, often for years. But why? One of the biggest reasons is social stigma. Talking about urinary issues, especially for men raised in an era of stoicism and privacy, can feel embarrassing or even emasculating. There's also the common belief that urinary problems are just a normal part of aging and not worth bringing up unless they become unbearable. Then there's fear. Fear of diagnosis, fear of prostate cancer, and fear of invasive tests or surgeries. Unfortunately, this fear can lead men to ignore symptoms or try to self-manage in silence. According to a survey conducted by the American Urological Association, nearly 40% of men with urinary symptoms waited more than a year before discussing them with a doctor. Some even waited over 5 years. Cultural expectations can also play a role. In some communities, men are taught to tough it out and avoid showing vulnerability, especially when it comes to health. But this mindset can be dangerous. Waiting too long allows the condition to worsen, often to the point where more aggressive treatments become necessary. It's time to change the narrative. Open conversations about prostate health can lead to earlier diagnosis, simpler treatments, and better outcomes. As Dr. Matthew Rettig, Chief of Hematology Oncology at UCLA, puts it, the earlier we catch prostate-related conditions, the easier they are to manage, and in many cases, to reverse. Ignoring an enlarged prostate doesn't make it go away. In fact, it increases the risk of serious health complications that can greatly affect a man's quality of life. What begins as a minor annoyance can escalate into problems that require urgent medical intervention. One major complication is chronic urinary retention, where the bladder can't empty completely over an extended period. This doesn't just cause discomfort, it stretches and weakens the bladder muscles, eventually making it harder to urinate at all, even with effort. In some cases, men are forced to rely on catheters long-term, which can be both physically and emotionally distressing. Prostate enlargement can also cause bladder damage. As the bladder works harder to push urine through the narrowed urethra, its walls thicken and lose elasticity. This makes it less effective over time, even if the blockage is later treated. In extreme situations, the pressure from the bladder can back up into the kidneys, resulting in hydronephrosis, a dangerous swelling of the kidneys that can impair their function or cause permanent damage. Furthermore, men with untreated BPH are more prone to urinary tract infections, hematuria, blood in urine, and bladder stones,
all of which can add pain, stress, and unexpected hospital visits to an already challenging situation. The bottom line? Prostate enlargement might start as a manageable condition, but it has the potential to turn into a serious health issue. Addressing symptoms early on gives men the best shot at avoiding these complications and preserving both independence and peace of mind. Recognizing the signs of prostate enlargement is only the first step. The next and most critical step is getting properly diagnosed. Fortunately, today's diagnostic tools are more accurate, less invasive, and widely available than ever before. The initial assessment usually begins with a detailed medical history and symptom questionnaire, such as the International Prostate Symptom Score, IPSS, which helps doctors gauge the severity of urinary symptoms. This is often followed by a physical exam, including the digital rectal exam, DRE, a simple, quick test where the doctor gently feels the prostate through the rectal wall to assess its size and texture. Another key diagnostic tool is the prostate-specific antigen, PSA blood test. PSA is a protein produced by the prostate, and higher than normal levels can suggest BPH, though elevated PSA can also be a sign of prostate cancer or inflammation, which is why it's used in conjunction with other tests. Depending on the findings, your doctor might order further imaging, such as a bladder ultrasound or urine flow test, to better understand how well your bladder is emptying and how much the prostate is obstructing the urethra. In some cases, cystoscopy may be performed to visually inspect the bladder and urethra using a thin, flexible camera. According to the Cleveland Clinic, early detection through these tests not only confirms the diagnosis, but also rules out more serious conditions like prostate cancer. In most cases, these exams are quick, safe, and relatively painless, and they can provide invaluable peace of mind. Once diagnosed with BPH, the good news is that treatment options are abundant and often highly effective, especially when the condition is caught early. The right approach depends on the severity of symptoms, the size of the prostate, and your overall health. For mild cases, doctors may recommend a strategy known as watchful waiting, monitoring the condition without immediate intervention, while encouraging lifestyle changes that help manage symptoms. But for many men, medications can provide significant relief. Two common classes of drugs are alpha blockers, such as tamsulosin or Flomax, which relax the muscles of the prostate and bladder neck, making it easier to urinate. 5-alpha reductase inhibitors, like finasteride or Proscar, which work by shrinking the prostate over time. In some cases, a combination of these medications is prescribed for enhanced results. According to the American Urological Association, many men begin to feel improvement within a few weeks of starting treatment. If medications don't provide enough relief, or if side effects become problematic, minimally invasive procedures are often the next step. Techniques such as transurethral resection of the prostate, or TURP, or Urolift, which lifts and holds the enlarged prostate tissue out of the way, can offer long-term improvement with minimal downtime. There are also newer procedures like Resume therapy, which uses steam to destroy excess prostate tissue. These advancements allow many men to avoid traditional surgery altogether. No matter the treatment path, the goal is the same: to relieve symptoms, protect bladder and kidney function, and restore a sense of normalcy. As always, decisions should be made in close consultation with a urologist who understands your unique needs. While medications and procedures are effective, lifestyle changes can play a powerful supporting role in managing prostate enlargement, especially when integrated early. These small, consistent choices can not only relieve symptoms, but also improve overall urinary health. One of the most impactful strategies is adjusting fluid intake habits. For example, reducing consumption of fluids in the evening, particularly caffeine and alcohol, can significantly cut down on nighttime trips to the bathroom. Both substances act as diuretics, increasing urine production and irritating the bladder. Dietary choices matter too. A diet rich in fruits, vegetables, whole grains, and healthy fats like those found in olive oil, nuts, and fish has been associated with better prostate health. Studies from institutions like Harvard's T.H. Chan School of Public Health suggest that men who follow a Mediterranean-style diet have lower rates of prostate complications. Certain nutrients are especially valuable. Lycopene, found in cooked tomatoes, and zinc, found in pumpkin seeds and shellfish, may help regulate prostate size. Green tea and soy products have also shown promise in some studies for their anti-inflammatory and hormone-balancing properties. Staying active is another important component. Regular physical activity, even light walking or stretching, can improve circulation, reduce pelvic pressure, and help regulate hormone levels. Men who maintain a healthy weight are less likely to experience severe BPH symptoms. And lastly, stress management. Chronic stress can aggravate urinary urgency and frequency. Mindfulness practices, deep breathing, and even hobbies that bring joy can help reduce tension and improve urinary control. These lifestyle adjustments don't require radical changes, just thoughtful, consistent actions that can make a noticeable difference over time. They also complement medical treatment beautifully, creating a more holistic approach to prostate health.
To further understand the urgency of early detection and treatment of prostate enlargement, let's turn to what science is telling us today. Recent studies and expert recommendations highlight just how impactful timely intervention can be, not only in relieving symptoms, but also in preventing irreversible complications. A landmark study published in the journal Urology found that men who delayed treatment for moderate to severe BPH symptoms were significantly more likely to develop bladder dysfunction and require surgical intervention down the road. In contrast, those who sought care earlier were more likely to benefit from simpler therapies and preserve long-term bladder health. Dr. Klaus Rohrborn, a renowned urologist and researcher at UT Southwestern Medical Center, emphasizes that prostate enlargement is progressive by nature, but the progression can be slowed or halted with early proactive care. His work has contributed to much of what we now know about combination therapies and minimally invasive procedures. Meanwhile, research from Johns Hopkins Medicine confirms the link between lifestyle, metabolic health, and prostate outcomes. Their findings suggest that men with high blood pressure, obesity, or insulin resistance are more likely to experience rapid prostate growth, another reason why diet, exercise, and regular checkups matter. Even international guidelines, such as those from the European Association of Urology, now recommend shared decision-making between patients and physicians, stressing that no two cases are exactly alike. Whether it's tracking PSA levels, reviewing urinary flow data, or discussing medication side effects, being informed and involved in your care leads to better results. Knowledge is no longer a luxury. It's a tool. And the more men understand the mechanics of prostate health, the more empowered they are to take charge of their aging process with confidence and clarity. As we wrap up today's episode, let's revisit the most important takeaway. Prostate enlargement is common, but it's not something you should ignore. The symptoms may start out subtle, but they can gradually impact everything from your sleep to your social life and eventually your overall health. If you're a man over 50 or approaching that age, now is the time to pay attention. Waking up frequently at night to urinate, struggling with a weak stream, or feeling like you're not emptying your bladder completely, these are not just signs of aging. They're warning lights from your body. The good news is you have options. From modern diagnostic tools to medications and minimally invasive procedures to simple lifestyle changes like improving your diet and staying active, prostate issues are treatable. You don't have to live with discomfort, embarrassment, or fear. Most importantly, talk to your doctor. Having a conversation today can prevent complications tomorrow. Don't wait for symptoms to get worse. Don't let stigma or uncertainty keep you in the dark. Thank you for joining us on Senior Health. If you found this episode helpful, please give it a thumbs up, share it with a friend or loved one, and consider subscribing for more content focused on helping you thrive after 50. Take charge of your health. Your future self will thank you.